Brilliant. Well, hello and welcome to this webinar. My name's Sara and I'm Professor of Health Policy and Practice at the University of Oxford. Amy, do you want to introduce yourself?
Yes, hi everyone. So my name is Amy Booth. I am co-director of the Green Healthcare Hub that seeks to decarbonise health and social care.
Brilliant. Thanks, Amy. And we want to focus this webinar specifically on organising health and care in an era of multiple environmental crises. We know already that healthcare impacts climate change and the need for health systems to organise in ways that are sustainable. And Amy and I want to revisit that and argue that we need to extend it, looking at how we organise healthcare in the face of multiple environmental crises. And here's why. So on March the 23rd this year, it was World Meteorological Day, and Antonio Guterres, the UN Secretary General, warned us all that climate chaos is rewriting the rules of weather, with new data confirming accelerated global warming. So his message came as the World Meteorological Organization confirmed the hottest 11 years on record, reporting concentrations of greenhouse gases in the atmosphere that have reached all-time highs and that continue to drive record temperatures across the world. This follows rising global temperatures over the last 150 years, as shown here on this graph, comparing current temperatures with pre-industrial levels. So then in 2015, the Paris Climate Agreement committed most governments to addressing climate change, with the goal of stopping the world's average temperature rising more than 2 degrees. Ideally, 1.5 degrees C above pre-industrial levels. And now, as this graph shows, with the policy and trajectory we have, the world is now close to exceeding that goal. The period from January 23 to February 24 marked the first full year to exceed this threshold, and the long-term average hasn't yet broken it. However, we are nowhere near what's required to limit warming to 1.5 degrees C, and some estimates suggest that it could be reached as early as May 2029. In short, our climate is changing and our planet is warming at an increasing and alarming rate. There are significant and now unavoidable and long-lasting consequences for us all. Rising global temperatures are associated with increased frequency and intensity of extreme weather events, and this graph showing sharply increasing frequency of global weather events over the last 40 years, as we're all now experiencing. So this includes heat waves. The UK recorded its first ever temperature above 40 degrees C in July 2022, reaching 40.3 in Coningsby in Lincolnshire. And this triggered the Met Office to issue its first ever red warning for extreme heat, caused significant infrastructure disruption and over 2,800 deaths. And we're recording this in June 2026 with what feels like a very similar series of events. Floods. We've seen repeated floods across the UK. This one, following Storm Bert in 2024, led to close to 100 separate flood warnings, and pictured here, the River Avon breaking its banks with at least 5 deaths and major infrastructural disruption. An increasing number of droughts and allied pressure on water security. This image is from 2025, which experienced the driest spring period since 1976 and resulting in multiple drought zones declared across the UK. And this one was in Yorkshire. Then we've also got wildfires, a relatively new phenomenon for those of us in the UK, with records being broken year on year. In the first 6 months of last year, so that's 2025, fire and rescue services in England and Wales had responded to 564 wildfires, which was a 717% increase on the same period in 2024. So these extreme events aren't going away. The examples that I've been talking about, they're all drawn from the UK, with direct impacts on morbidity and mortality through heat stress, injury, displacement, and indirect impacts on patterns of infectious disease, food security, and also mental health. And these impacts and more are mirrored across the world. But the impacts from climate change and the allied health burden is unevenly distributed, disproportionately impacting low and middle income countries and vulnerable populations. And this slide shows exactly that. So with countries with the highest emissions and lowest vulnerability in dark red, And as you can see here, that's largely in the global north, what we sometimes call the climate free riders, and those with the lowest emissions and highest vulnerability in dark green, largely in the global south. But climate change isn't the only concern. So we're experiencing a convergence of environmental crises. Alongside climate change, we have biodiversity loss, pollution, land degradation, and also resource depletion. Biodiversity loss is a deeply interconnected crisis. We have ecosystem degradation alongside accelerated species extinction. And this is a photo from Sudan, of Sudan, the last male northern white rhino that died in 2018. So this species extinction, it undermines the ecological systems that sustain life, such as water purification and disease regulation. And reduced biodiversity has been linked to increased risk of zoonotic diseases and their emergence. Pollution, including air, water and soil contamination, it remains a leading environmental determinant of disease, contributing, for instance, to cardiovascular and respiratory disease. Chemical pollutants, including endocrine disruptors and heavy metals, are associated with cancers and developmental disorders. And microplastics are also an emerging concern with uncertain but potentially wide-ranging health effects. Land use and degradation driven by urbanisation, deforestation and intensive agriculture exacerbates all of these dynamics, as does resource depletion and our extraction and consumption of natural resources at a rate that's faster than they can be replenished. And these crises are not discrete. They're tied together in a syndemic of environmental change. So the cumulative effect is a destabilisation of the environmental determinants of health, with massive and cascading consequences for healthcare demand, for supply chains, for infrastructure resilience, and also workforce capacity. So this is already exposing the fragility of existing models of healthcare, and that's in the UK, but across the world. And health systems aren't really designed for climate volatility and ecological disruption. Systems globally are feeling the constant pressure of multiple ongoing events, with, for instance, there's lots of examples to choose from, hurricanes in Alberta damaging infrastructure and services, causing power failures, rising emergency admissions, and increased costs. Emergency responses are also vital in these kinds of situations and becoming more frequent, but they also then divert resources from more routine care. So it's ironic then that our health systems are actively and directly contributing to these environmental crises. Amy, over to you.
Thank you, Sara. So Sara has quite importantly outline how devastating some of these climate and environmental crises are for humanity, but in particular for our health. Now, at the same time, the way we deliver healthcare has environmental impacts. So up to 5% of global greenhouse gas emissions are thought to come from the health sector. This is in comparison, for example, to the aviation industry, which only accounts for about 2 to 3% of global emissions. If we look at where that comes from, you can see two examples of carbon footprints from the UK on the left and globally on the right. And you can see hotspots of emissions are pharmaceuticals, energy, and primarily the supply chain. So most of the carbon footprint of the healthcare that we deliver comes from all the goods and services that we use to deliver that healthcare. There have been a wide range of research studies that have looked at the carbon footprint or greenhouse gas emissions of different aspects of healthcare. I've just included two examples here, firstly to show how huge some of these emissions are, but also to show how the impacts differ depending on what health setting you look at. So, for example, we look at the carbon footprint of an ICU bed. A single day spent in an ICU bed in America, you would have to plant about 3 trees to offset that. Similarly, in Australia, you'd have to plant about 1.5 trees. So that's 1 day per person in an ICU. Cataract surgery, If you look at the bottom in the UK, a single cataract surgery, you would also have to plant about 3 trees. But by comparison, in India, it would only take about 0.1 trees to offset that. So you can see the vast difference in the environmental impact of the way we deliver healthcare across different health settings, and perhaps some of the lessons that we can learn about delivering healthcare in more resource-constrained settings. So that's greenhouse gas emissions. Obviously, energy use is directly tied to carbon footprint and to climate change. And we know that health systems use a huge amount of energy. They're functioning 24/7 every day of the year. They have lots of machinery and lights and equipment. And for example, operating theatres are about 3 to 6 times more energy intense than the rest of the hospital. And again, you can see why all the ventilators and machinery and operating equipment. As Sara mentioned, climate change is just one environmental impact that we contribute to. Health systems also use a lot of water, for example, and we know that water is becoming more and more scarce and a scarce resource around the world. And so here are some examples of how water intense healthcare can be. A single surgery uses about 18.5 litres to scrub up. The surgery itself uses about 50 litres. Dialysis, so for patients with renal failure, up to 800 litres of water per single dialysis. So that's huge amounts of water that we are using every day in healthcare. Health systems also produce a lot of waste. I'm sure you are all familiar with how much waste we were producing during the COVID pandemic. That waste is often hazardous, biological, containing blood or chemicals. And so that means that waste has to be incinerated or managed in a very strict manner. But we also produce other types of waste in healthcare as well. And as you can see here, a lot of that waste is often not managed correctly and ends up in our environment. Health systems also have other environmental impacts. So pharmaceutical pollution, for example, is one environmental impact that is specific to health systems. So all the medicines that we consume and excrete, or that we throw directly into the bin or down the toilet, or that we sprinkle into agriculture or aquaculture, or that we give to cattle or our pets, all of that will eventually end up in the environment. And so more than 900 pharmaceutical residues types of pharmaceuticals have been found in the environment, and we know these have disastrous effects on ecosystems, for example, causing feminization of fish, mutations in rats, and importantly for our health, contributing to antimicrobial resistance. So health systems have huge environmental impacts, and I'm going to hand back to Sara, who will talk a little bit about how we can actually navigate some of these impacts.
Amy. Yes, well, I suppose in some we really urgently need to understand and address these impacts. And this is really the focus for the rest of our talk, and taking perhaps a more positive spin. So how to organise healthcare in the midst of these environmental crises. So we're going to set out what environmentally sustainable healthcare can look like, but also some of the challenges to progress. And what we really want to argue is for a reimagining of how healthcare is designed and delivered. And we want to persuade you that environmentally sustainable healthcare is a prerequisite for safe, equitable, high quality, affordable, and really resilient healthcare. So we thought it'd be helpful to just do slightly longer introductions about why we think we're well placed to talk to you about this. So I'm Sara. My background is a social scientist. I studied sociology and policy analysis, and I've been working in medical schools and research organisations for longer than I care to think of, but over 30 years. And I'm really now working at the intersection of healthcare, policy, technology, and sustainability. And in many ways, I'm a novice in the field of sustainable healthcare. I've come to it through personal interests and personal motivations, and really a profound concern for our planet, but also our health system, and really concern for my friends, my family, for the next generation, and particularly my 2 daughters. And that's what's driven me to come to this and begin to study it and understand it a bit more. Amy.
Thanks, Sara. Yeah, so I have a medical background. I trained and worked as a doctor in South Africa. And as Sara mentioned, countries in the global south are disproportionately exposed to the impacts of climate change. And so I saw firsthand how climate change was impacting people's health. I also had to work through several extreme weather events that were caused by climate change, so floods and droughts. I also practiced during the COVID pandemic and saw then how environmentally unsustainable the way we deliver healthcare was with all the PPE waste that we produced. And so, really seeing the interconnections between the environment and healthcare prompted me to leave clinical practice and do engage in research on this topic. So, I completed my PhD looking at how we can decarbonize pharmaceutical supply chains. And now, as I mentioned, work at the Green Healthcare Hub, which uses research to help support decarbonization of the NHS. I focus primarily on sustainable medicines and pharmaceutical pollution.
Brilliant. Thanks, Amy. So the question now really is, what then is environmentally sustainable healthcare? What does it look like? It involves the organisation and delivery of health services in ways that minimise environmental harm while maintaining or improving health outcomes. So it requires a shift from a kind of narrow focus, if you like, on clinical activity to a whole system perspective that accounts for carbon emissions, resource use, pollution, and ecological impacts across the full life cycle of care. So in practice, this involves reducing demand for healthcare through prevention and early intervention, while at the same time ensuring that necessary care is delivered using the lowest possible environmental footprint. So clinical pathways are redesigned to avoid low value or unnecessary interventions and to prioritise models such as community-based care and digital consultations where it's appropriate. At the same time, procurement becomes a really central lever, given that the majority of healthcare emissions arise in supply chains. This includes working with suppliers to reduce emissions, waste, and harmful discharges. Infrastructure and services also need to be adapted to a changing climate, ensuring continuity of care during extreme events and reducing vulnerability to environmental shocks. And I say that, like it's really simple, but it's a really complex thing to do. And importantly, environmentally sustainable healthcare aligns closely with quality and safety goals. So reducing waste, improving efficiency, and focusing on prevention can, at the same time as lowering costs, also help to improve outcomes. So really what we're talking about here is a challenge that's less technical than organisational, and it requires really coordinated action across policy and regulation, the way we design and deliver services, and how practitioners and patients engage with healthcare. So the macro, the meso in the micro, if you like, in the health system. And that demands really a fundamental rethinking of how health and healthcare are conceived, organised, and also practiced. And I'm going to hand over to Amy now, who's going to bring that to life for you.
Great, thank you. Right, so Sara's mentioned sort of some of what needs to happen to bring about sustainable health systems. But I want to come back to the complexity of how we actually achieve this. So if we take the simple example of a speculum. Now, copious amounts of research has shown that reusable speculums, made of stainless steel, for example, are much better for the environment, also cost less, and are often more comfortable for patients. At the moment, in many health systems, the plastic single-use speculum is the one that's used most routinely. So if we look at the research, it's sort of a no-brainer that switching to reusable speculums is a key step that we can take towards sustainability in this aspect of healthcare delivery. But what needs to actually happen for that to change? Firstly, you need medical device companies to produce reusable speculums and to create systems in place to allow for the reprocessing and sterilization of them. Secondly, we need health system teams, procurement teams, to actually buy the reusable rather than the single use. We need health systems to have the proper infrastructure to sterilize, reprocess, and repackage these devices for reuse. We need clinicians to understand how to use these and to prioritize their use and to choose them when they do speculum examinations. We need patients to be comfortable with having reusable devices. And so across all of this, we need policies to support this, education and behavior change. And so when you think about what seems a really simple change in practice, a lot needs to happen around that to actually bring that to light. So what we want to talk through now is what needs to happen and what is currently happening to actually bring that image of environmentally sustainable healthcare that Sara mentioned to fruition. So Sara mentioned the macro, meso, meso aspects of it, and we'll structure our conversation around that. So what needs to happen at the macro level? And here we speak really about how we can leverage policy and regulation to bring around sustainable healthcare. So right from the top, we need legislative change mandating and embedding sustainability as a core objective of health systems. We also need national and local policies to embed sustainability and to ensure that existing policies don't actually lock in unsustainable practices. Obviously, across this, we need to consider unintended consequences, like will policy change towards sustainability potentially have financial implications or health implications that we need to consider. And importantly, we need to consider the enforceability of some of these policies and regulations, because what often happens is that you have this beautiful policy that speaks about sustainability, but when it actually comes to implementing it in practice, it's not enforceable. And so just bringing your attention to a key example in this space, if we look at the UK, in 2008, Parliament passed the Climate Change Act. So that mandated every single government department to reach certain climate targets, including the Department of Health and Social Care. And so that led to the development of the Sustainable Development Unit, which is now the Greener NHS, which has been mandated with making the NHS more environmentally friendly. And so under that, the NHS has produced several greener NHS plans, net zero strategies, so really embedding at that policy level the need to reach net zero as a health system. But what's even more interesting is that within healthcare policy itself, so the Health and Care Act of 2022 and the NHS's 10-year health plan, even in those primarily health-focused plans, we're seeing aspects of climate change and environmental sustainability being brought into them, and so becoming a core aspect of these health policies. And of course, these are still fairly sporadic and hasn't yet been implemented as we would like to see, but it does point to a shift in the policy direction, a positive shift. So at the meso level, here we think about organizing and delivering environmentally sustainable healthcare. This is huge. We're not going to be able to cover everything in this space, but what we'd like to draw your attention to is 4 key aspects. So firstly, infrastructure, the actual design of health systems and health facilities. Are they using renewable energy? Do they have automatic lights that switch off when you're not using them? Are there efficient ward flows, for example? Secondly, we're thinking about procurement. So what materials actually go into healthcare delivery? Where are we procuring them from and from whom? Are we looking at the most environmentally sustainable companies to procure these materials? Are we procuring the reusable items rather than the single use? Thirdly, healthcare pathways. So here we're looking at the actual patient journey through healthcare, and is that the most sustainable and efficient pathway as possible? So from the moment the patient enters the health system to the moment they leave it, is that the most sustainable way of delivering healthcare? And then fourthly, we realize that we're not going to be able to radically change health systems, although perhaps that is what is needed at this point. But can we embed sustainability into existing practices? And I will talk through some examples of that. And obviously bearing in mind that overarching all of these are the people and processes that ensure whether they're implemented effectively or not. So just some examples of some of these. Speaking about infrastructure, the NHS, for example, has a net zero building standard. So all new NHS buildings have to meet these standards. Obviously, some of the challenges here is the existence of older buildings that are often protected sites, so how you actually change existing infrastructure. But to draw your attention to one positive example is this hospital in Cardiff, which has ambitions to be the greenest hospital in Britain. And you can see lots of natural light and green spaces, etc. So this is still being built, but it will be interesting to see what it looks like when it is done. Secondly, I mentioned procurement, and globally we see examples of different sustainable healthcare procurement policies that are being created. So for example, Healthcare Without Harm, which is an NGO that seeks to decarbonize healthcare. They've produced a guide. We see Norway, for example, uses their sustainability policy. And so they attach a 30% weighting to sustainability in their tenders. And similarly, the NHS has its supplier roadmap, which is asking suppliers to produce decarbonisation plans and to align with net zero targets. Again, some of the challenges here are it's actually whether it's implementable and how effective it is at actually driving upstream industry action. I mentioned care pathways. Again, this is a very busy slide, but what I want to draw your attention to is the green stuff. So this is a bladder cancer pathway, and the black is your traditional pathway, and the green is how we might think about tweaking the pathway to embed sustainability. So things like same-day preoperative assessment or using more reusable surgical equipment. And then I mentioned how we can embed sustainability within existing practice. And so this is one example, the SUSQI Academy, and this is produced by the Centre for Sustainable Healthcare in the UK. And so they do a lot of work going into wards and hospitals and creating greener teams to actually embed sustainability within existing practices. And so I would encourage you to look at some of the work that they are doing. And then overarching all of this, we often think about technology innovation as the means to bring about change. And there are very promising technologies, especially around, for example, telemedicine and reducing travel emissions. But again, I think it's just worth bearing in mind what needs to change to allow technology to work effectively, as well as some of the unintended consequences of this. And then finally, we look at the micro level. So what actually needs to happen with the individual to enable us to practice environmentally sustainable healthcare? And there are two key stakeholders here. So firstly, health providers. How can we actually embed sustainability into daily clinical practice? And then secondly, patients and the public. So thinking about social movements and patient advocacy and what patients can do to embed sustainable healthcare. And so some examples of these campaigns, so the Choosing Wisely campaign wasn't initially started to focus on sustainability, but rather to produce the most judicious and effective care as possible for patients. But what people have realized is that actually that is the most sustainable care as well. And so we're seeing more Choosing Wisely campaigns focused on environmentally sustainable healthcare. And then I also mentioned social movements and NGOs and their role in bringing about sustainable healthcare as well. And obviously, Healthcare Without Harm is one globally that seeks to do this. As I mentioned, patients also need to take part in some of these actions. And one key aspect where they are particularly important in bringing about change is the example of take-back schemes, where patients can bring back, for example, unused medicines or unused medical devices for proper disposal and management. And then last 2 points is that we really need leadership to drive this forward. And so we have examples globally of change makers, so people like Forbes McGain from Australia, Nick Watts and Chris Gormley, who are our NHS Chief Sustainability Officers and various sustainable fellowship schemes. And these people have been really instrumental in driving forward sustainable healthcare. But what we really need is to move from these individual champions to ensure that everyone is leading for sustainable healthcare. As Sara mentioned, these are urgent challenges that have direct impact on society and health. And so we all need to play our part. And then finally is the role of education and awareness. And so we need education and learning to be embedded within medicine and healthcare. We need to raise awareness and to build capacity to allow our health providers to actually embed sustainable healthcare. This can be both formal and informal, but I think importantly, we need to ensure that it actually facilitates action rather than becoming overwhelming. So we know that environmental science is quite a complex field, and we're not intending all our health providers to become climate scientists, but we need to ensure that they have sufficient knowledge to allow them to embed action. And so some key examples of this are the GMC, the General Medical Council in the UK, which has now embedded sustainability as a core objective within undergraduate medical training, and Planetary Health Education and Prescribing, which is an EU project seeking to teach prescribers how to consider the environment in their prescribing practice. So as you can see, a lot is happening, but obviously more needs to be done. So I'm going to hand back to Sara, who will conclude the session.
And thanks, Amy. I mean, as you can see, there's a lot has been achieved and progress has definitely been made, and it's variable across settings, across different countries, but there is progress integrating environmental considerations into healthcare. And I would say especially since the early 2020s, so over the last 5 years or so. However, while green initiatives, if you like to call them that, are accelerating, environmental factors are not yet fully integrated into health systems and all healthcare decisions. So I think in this final part of the webinar, we'd really like to ask why isn't more happening, and to really point to 5 key challenges. And there's lots that we can say here. I think focusing on 5 is probably enough for now, and over to you to kind of unpack those and even go a little bit further, but these are definitely the headlines. So first off, environmental sustainability isn't mainstream in health systems, and it's not yet embedded in decisions about how we plan, design and redesign, evaluate, deliver, or indeed receive healthcare. So while we're seeing the kind of green initiatives that Amy described, these are typically seen as somehow separate from mainstream healthcare, almost over to one side, as a public health problem and something to the side for others to think about. Even worse, the kind of environmental crises that we've talked about are still framed as situated elsewhere, with distal impacts often on vulnerable populations. And this needs to change. It needs to be actively built, governed, and adapted every day through coordinated, system-aware action. And this urgently requires a shift away from the largely ad hoc and uncoordinated initiatives we're currently seeing, towards embedding and routinizing environmental sustainability as a dynamic property of health systems themselves. So then it becomes a part of everyday clinical and non-clinical work of the healthcare workforce and a part of all decision-making in healthcare. So the second challenge for us is really right drift over left shift. So let me unpack that and explain that a bit more for you. So a left shift in healthcare is really about moving care upstream towards prevention, early intervention and community-based management, rather than hospital-based and hospital-centred late-stage treatment. And this is really critical for environmental sustainability, because most healthcare impact is driven by the intensity of care, not just volume. So if done well, and therein lies a really important question for current policy, it holds potential to avoid high carbon, resource intensive care, target major drivers of disease burden through prevention and early management, reduce demand, enable lower intensity care models, reduce the use of pharmaceuticals, and so on. Many of the things that we've started to touch on already. However, while successive governments in many of our health systems have promised to move care away from acute hospital settings and into community-based proactive services, in reality, the reverse has happened. So what we've instead seen is a right shift with entrenched illness-focused, reactive and resource-intensive models of care. And while current policy is promising in some countries, not necessarily others, we still need fundamental change to emphasise prevention and work towards reduced use of resources. So third challenge, structural conditions. So a right drift that I've just been talking about, it's not an accidental outcome. It's the result of financial flows that have funded hospitals for their activity and much of the rest of the NHS for their efforts. And I'm focusing there particularly on the UK and the NHS, but this holds in health systems across the world. Finance models and incentive structures prioritise more healthcare and more demand. Essentially, sickness pays. So prevention, a left shift, and environmental sustainability doesn't. Not only that, but initiatives like decarbonisation are perceived as a drain on healthcare resources that might be better spent elsewhere. We obviously disagree. Framing decarbonisation as a drain just misses the point. It depends on where, how, and over what timeframe changes are made. Some interventions like energy efficiency or waste reduction can require upfront capital, but they also generate net savings, often really quickly, if they're implemented properly. So fourth, patient versus planet. And this is a classic one. There's a perception here that environmental sustainability comes at the cost of meeting patient needs, with clinicians trained to act in the best interests of the patient in front of them, but sustainability then introducing expectations around resource stewardship and constrained choices. This narrative, I mean, Amy and I disagree with it basically, but this narrative can create resistance amongst clinicians and patients if it's perceived as compromising care rather than improving value and reducing harm. But it's also misleading. Most of the time, high quality care and environmental sustainability align. So for instance, where clinically appropriate, switching from metered dose inhalers to clinically equivalent dry powder inhalers improves environmental performance without compromising outcomes and improving disease control, whilst at the same time lowering emissions. So a more productive approach then is a shift away from trade-offs and intentions and instead to focus on value. So identifying and reducing care that offers little or no benefit, choosing lower impact options where outcomes are equivalent, and addressing upstream determinants of health. So to our final challenge, underdeveloped research capacity and skills. So that results in limited research. And this is a relatively new field, and it's one that sits across clinical medicine, health services research, environmental science, engineering, and social science, and including social studies of healthcare organisation, which is a big part of what we're talking about today. But structures and funding to support integration and interdisciplinary research are very definitely underdeveloped. There's a fragmented and immature evidence base with environmental impacts of health systems unevenly studied, varied methods, and results that aren't easily comparable. So reliable, granular data on emissions, on resource use and pollution at pathway or intervention level are often unavailable. And environmental outcomes are rarely included in trials, health technology assessments or clinical guidelines, and that just makes it really difficult to consider them alongside safety and effectiveness. Many clinical areas also lack robust life cycle data, and most health professionals, social scientists too, receive little or no training in carbon literacy or environmentally informed decision making. So it's a big gap, like Amy was saying, in terms of education and awareness. What research there is, and it is growing, is concentrated in high income settings with limited applicability elsewhere. So lots to change. We need to urgently confront and navigate these challenges. And there's much relevant and positive work going on, but the scale of the problem really needs us all to be, or to do more, basically. And Amy and I want to end on a positive note. We've sort of started out really quite depressing and then sort of flagged out where things are happening, and we want to definitely end positively. There are many working in this space who wouldn't and see our rapid pace towards global warming and environmental breakdown as fundamentally irreversible. We disagree. However, if we're all to stop this webinar, do nothing, then multiple environmental crises we've outlined are going to continue, and so will the health impacts and system strain that comes from that. So our call to action is fivefold. First of all, build sustainability into your work on healthcare and the way we organise, design and deliver healthcare. Build research, evidence and theory about the impacts of environmental crisis and the role that health systems play and how we can collectively address them. Second, work with complexity. Thread sustainability through everything. Don't silo it off to one side. Understand distal impacts, acknowledge and take responsibility for the ways that our own health systems have consequences elsewhere in the world, and be prepared to action things that can address it or redress it. Third, work with others. So approach this as an interdisciplinary field. Work with others, recognising that there's no single specialist or discipline to rely on here, and that organising for sustainable health and care is critical alongside environmental science, patient and public engagement, and more. Fourth, learn new skills and ways of understanding, measuring, enabling, and practicing sustainability. Embed them in your everyday practice and existing ways of working, and make the most of any kind of professional development that you've got at work, and extend those skills and ways of understanding. And finally, engage policy and practice, professionals and public, in designing and delivering healthcare that recognises and addresses the multiple and intersecting environmental crises that we're facing. Cool. So we're going to finish by returning to Antonio Guterres' call to action. By observing today, he said, we can protect tomorrow for people, for planet, for prosperity. And he said, for generations to come. His focus was on the need to accelerate early warnings for all so that every person on Earth is protected by life-saving alerts. We urge similar for health systems to urgently organise healthcare in ways that confront the multiple environmental crises that we're facing, to understand that environmentally sustainable healthcare is a prerequisite for safe, equitable, affordable and resilient care, and to accelerate sustainability so that healthcare works for people and for planet for generations to come. And everyone has a role to play, including you. Thank you.